More on health news now. We're talking about vaccine prices, and they've gone from what were single digits to sometimes triple digits just in the last 2 decades. The Centers for Disease Control says since 1986, the average cost of vaccinating a child has jumped from what was $100 to nearly $2,200. So what does that mean for the rising costs of family health, these vaccine prices? Well, Dr. Kristin Woodward is back with us this morning to talk about that. Let's first start with doctors, because this really does put the doctor in the middle of a tough spot.
Absolutely. This is becoming a big problem. I mean, vaccine costs have risen over the past few decades. And, it's getting to the point where a recent study showed that about 30% of primary care providers are considering not offering vaccines.
Okay, so most people, I don't think, notice the cost of vaccines if they carry insurance. But what does this do? How does this really apply to people as far as the vaccines becoming so expensive?
Well, fortunately for patients, vaccines are covered by the vast majority of insurance carriers. But the unfortunate thing is providers aren't being reimbursed for the cost, administration, and storage of the vaccine. So it's getting very tricky for providers to find affordable vaccines that they can offer to patients.
What are the reasons that these costs? What are drug companies saying why the costs have skyrocketed?
Well, in the 1990s, companies were able to place time-limited patents on vaccine process and production. And that led to limited number of companies offering vaccines. Now, and we have this continuous demand that kids need their vaccines. And the other concern here is we know that shots and vaccines are very complicated to make. It's a very difficult process. And they require a lot of research before they're allowed to be given to the public. But physicians are asking, once those costs are recovered, why doesn't the cost of the vaccine come down?
So you just think about this as, we think of it as a health issue, the drug companies think of it as a business issue, and they're making pretty good money on the vaccines.
Absolutely, and the good news in Colorado is that primary care providers are working with the Colorado Department of Health and local health departments, as well as the vaccine industry and the health insurance industry, and our goal is to have access to vaccines at all clinics for all kids. That's really the goal.
If you want to have your child vaccinated in Colorado, this is not a problem yet. You think vaccines will be available?
The biggest problem in Colorado is rural communities and then solo practitioners. Now, if your provider doesn't have access to a vaccine, they can refer you to a clinic that does. There's a lot of public health clinics and other practitioners that will have access to vaccines. But this is becoming a big problem across the country.
It's amazing to see how much money it is nowadays to vaccinate a
it's
child.
Big business,
28
like
years
you
ago,
said.
it's grown 22 times.
Exactly.
Dr. Kristin Woodward, we always appreciate you coming by. Thanks.
Absolutely, thank you.
Still to come, back to school supplies. Yeah, it's not that time yet, but you can save money on them if you buy